So I'm just doing this video because we've got the man over there. He's going to take no notice of us. No good with cameras, but he's over there anyway. We've got 5 dogs. Ding, 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 ding. There's the next one. Hello, go. Psycho. Hello, baby girl. The blind one. No risk assessments done on them. We've got a trolley which has 2 drawers there of medical emergency equipment. That again, sorry about the language, that again has no emergency procedures, protocols, policies, bugger all. I'm quite annoyed today because this is where Ben was living before Christmas. The kitchen's, you know, everything's okay normally. It's a big room. Now, when we get to this station here, this is supposed to be called the donning and doffing station, and that door there is aerosol generated procedures. Not my problem that the NHS can't get their act together and actually put anything about this care package that they've put together. Oh, sorry, I've got really bad knees. Right, so they've put this care package together, so-called. They had a lot of paperwork to put a care plan together. Substandard care plan, which is for somebody, brain injury. I can't really give you names, but there is the substandard paperwork to a client that is at very high risk of, if you want to call it COVID these days, call it what you want. However, these should be spotlessly clean. We had my night member, a staff nurse. I'm just annoyed and I could cry. Last night, and these bins were emptied hopefully today, look. But last night, I mean, that even shouldn't be hanging, you know. But I've only had 4 hours with a nurse this morning. And as you can see, the bins, I can't touch them. I've got no gloves on, and I'm not going to touch them anyway because I don't know if they're getting washed. There's no checklist, so we've put this donning station together. Oh my God, I've had this here. Oh God, a year and a half. I don't know, 2 years I've been in COVID with my son. So, you know, I expected the really high-end care from a really good provider. However, this paperwork, this donning station, I've had to clean it all out again. All the stickers have gone off the top for small, medium, large. So everyone's just piling box after box because everybody's different. They've got different faces, do you know what I mean, with the PPE, etc. So I am keeping as much clinical stuff, even going, let's go to the kitchen. So this is, sorry, these are leaves on the floor. I've just had a nightmare of a day. I've got to walk slow. However, right there, right, this is how the staff have to come in. Sorry about the milk being there, but it's off and I've just got to go and get rid of it. So they're supposed to take the temperature, clean the temperature gauge afterwards, you know, sign in, you know, do all the normal stuff. Right, they've even got clinical wipes there if they want to use them. You know what, look at the substandard cleaning, they can't mop a floor. What's wrong? I am moaning about the NHS. Last night, right, yesterday this was cleaned, right. We've got 5 dogs, like I said. I have to live with my son right now. And there's leaves, you know, I've got no staff today. Like I said, I've got a 4-hour shift with somebody just because of this situation. Now that trolley is a medical emergency trolley. Hello, Spirit. And I've had to bring it in here because when we go through this door right now, I need to sort of like not cry, because I have never ever in my life known anything like it. And I don't have to wear gloves because I've got to strip the bedroom down. So this is clinical room. And this is what happened. We had a soil pipe leak, right? So this morning, it's took a month for me to get them, because all I'm doing is I'm still clinically leading a package of care that they get, God, over 250,000 a year plus. I don't really want to sort of say too much about it, you know, and we're getting substandard care. I mean, down to the skirting board, it could have been wiped. I've had to wipe under the bed before. I mean, you know, all this has got to be spotlessly clean now by my daughter's coming in. But I've got to do all this medical stuff. So I'm not bothered about this right now because it's already been manually touched. And it's been manually touched by a nurse. There's no protocols. There's no procedures. There's no nothing for this machine apart from my own company that did it before. And this mask, which I'm really angry about. Here. Look, I mean, it's a mess, like I said, because I just don't care. Inside that mask, a nurse put the hand in it this morning with no gloves. No gloves. Not a glove. Now, this ventilator itself, right, I'm really peed off with, because the NHS gave it my son, which was recalled back. We're having issues because all these nurses are coming in. There's no procedures, no checklists, no protocols, no nothing on this dream station. That is kind of the fault on it is, well, you know what? It's the humidification to it. And humidification means it's water in here, sterile water. So the water in here goes up the tube. Now, NHS don't provide people in the community either. I'm going on with everything because I'm fed up. They don't provide them, not even with a filter. So we have to buy them ourselves. It's not his fault he's on a ventilator, is it, the NHS? So that is faulty. Right now, I've got to ring respiratory to get myself, my son, a ventilator, a new one, because it's gone, because somebody's messed with it. And according to my son this morning, it was a night member of staff who, I don't know what grade he is. I haven't got a clue. But they're nurses, okay? They should know. Like this machine here. You know, it's kind of like, so we've got another machine, right? So I've got to clean and scrub with my daughter. Absolutely everything. Because nobody has bothered to check. So this machine, I'm going to start it because it's so what it does is it gives, that goes into the lungs. You see it moving? Sucking, so that sucks in. It's not being cleaned. It's not being cleaned. There's no protocols. There's no procedures. I haven't seen a policy. Right, I'm angry. Really. So you've got then the oxygen. This was this morning. I've had to strip the oxygen to bits. So the oxygen, because we've had to keep moving my son from that room to this room. So what I've had to do is make up a circuit myself. Obviously, because we're in COVID. This video is going to go on forever. I'm trying to cut it down quick. There's a new set anyway to prove that at the NHS that I do my job. Don't ever call me messy again. In the meantime, I have to do this myself because, you know what? I've got no safety checks. And this, not here, it was kinked last night. So my son has retained carbon monoxide, you know. What they're trying to do, kill him. You know, he's had COVID. I mean, for God's sake, please give me a break, because you know what? I can't believe that these people have not even got a policy for aerosol generated procedures. So that means that right now, if Ben's not in the room, sorry, I'm angry and I'm really hurting inside. So if Ben's not in the room, I can come in with just a medical mask. I'm not wearing mask, okay? I refuse. I've tested them. They don't work. However, staff, they come from the NHS via whatever. They are being commissioned by the NHS, I just say. And I'm just so pissed off because we get to the drugs. Okay, we'll get to the oxygen tanks first. Oxygen tanks are only being checked by the ICU nurses. Is suction unit. There it is. Hello, everybody. I've been waiting for one nurse, two nurses, and so far, you know, not all your nurses have checked that. It's out of date. It needs back testing, and nobody gives a cack. But this is it. These tanks should be checked because underneath we have extra masks, which this should be wiped down. We have sets nasal. No, that's a bigger mask. Sorry, but we do have nasal cannula. There's a nasal cannula. I'm just proving this because, you know what, my solicitor has handed this over and I'm not very happy about this clinic called Leg Care and the CCG, the NHS, obviously all that lot are involved. So then what is this? Is this not licensable equipment? Should this, please somebody, God help me, because should this not be under the care plan? Should this not have a policy procedure? Well, you know what? This is out of date. Has anybody picked that up? I will mention one. I can't mention the name, but yeah, one. The others haven't had time. This is the one that's in date. So, you know what? I'm having to still show ICU nurses, you know, equipment. This, last night, this has pissed me off. Right. I have to keep everything here as clean as I can. And I have to keep small, large and medium. I haven't got one for extra large, right? We keep them in the dining station next door. And I also give the nurses extra large because, you know, we've got large, some people, we've got men and women anyway. These last night was not replaced and wasn't dusted. You know, what the heck is going on? I've had to take my own company stuff off. However, I've left bits because you see all that up there. I haven't got to the main point yet. All that up there, and I mean the real main point. So you got vomit kit, you got emergency kit, you got whatever kit. That belongs to my company. However, I can't remove it. They'll probably moan at me saying it out of date. Come and check it. You know what? I wouldn't care if mine was out of date because at the end of the day, I'd still put a plaster on my hand, finger, whatever. Let's get to the medical. Now, Miss Muggins here, right, because she's disabled herself, and they know she's disabled. I can't give you all them names, because they've got names on, right? However, I've had to make my own. Look at that. Look at the state of the cupboard. And is that a pill? Because I mean, I caught 3 pills today. Any pills there? Let's have a look. There's something there because I can feel it, you know. I'm just, there you go. There's a vitamin. What else is in there? Mess, dirt. There's something there. There's another one. So nobody. Come on, guys. You're supposed to be top. You're not that top right now. CQC would have your asses for medication because on your mark sheet you haven't got his main one that is life-threatening and will kill him, and you have not got that on your mark sheet. That is disgusting. How dare I got called by somebody messy. I'm not messy. Don't ever call me messy. I'm doing this video so that it is recorded because I've gone back to my solicitor over this because I'm not happy. I've gone back to the CCG because I'm not happy, because we've had 2 episodes of AD, which is something really life-threatening, like I said, and we have to keep this special to spinal injury people and they die, right? So it's in there, and it's something called autonomic dysreflexia, AD. And this AD will kill. It kills a lot of spinal injured people. They've got no policy, no procedure. They haven't even got it on the medication. So it's called marshy in their world, right? It's not on there. I'm disgusted. I'm flipping fuming. I could cry. The toilet. None of the handles were getting washed down, only by certain nurses. I've had to bleach because there was pee around that way and around that way. And like I said, this is crap. This is because, you know, I've got all the kit here, everything here, right? And you can see, look up there. What's that? Is that antibacterial and toilet roll hanging up? Don't do that. They know how I work here. There's his toothbrush, for God's sake. You know, I've got to be as clinical as I can, but I don't want to be over-clinical because he's already had COVID infections and God knows what. So you know what? He's got immunity and he hasn't been able to take your jab things, jabberwooies, or whatever anyone wants to bloody call them. They don't work anyway. You know, this here, sorry, I don't know what happens with the lighting. Anyway, this there, let's turn it on, is a soil pipe behind there, and the whole of the wall now has got to come out. My son's got to move. He doesn't know that his language in there's a bit bad, but mine's much worse sometimes. But you know, all this medical equipment is in between two rooms at the moment, and I've got, like, these nurses they're supposed to have put up a whole care package of care for someone's very, very high up spinal injury. Not as high as Christopher Reeves like he was, but you know, high up in the spinal injury world, brain injury, and he's got other kind of underlying problems. You know, he's very unique, and this is why we set a company up. We run it for pilot scheme for 10 years, and I got called messy because all we did, I haven't made no profit. You know, it's just had staff, and we just done it how we did it, and now we're ready to go out, you know, and I'm being stopped because I'm on the sick, because I've got osteoporosis, and my osteoporosis, well, I can't hardly walk. My pain is horrific. I'm supposed to be on morphine, and I can't take the morphine because I'm still having to look after my son. And I'm at my wit's end because he's had, this is honest truth, and I know I'm going on, but I'm just making sure I cover everything. He's had a urine tract infection, right? How can you get that this quick? We've only had staffing for 10 days, a urine tract infection. I vomited upstairs. Don't ask me how I'm getting up and down them stairs, because that's another thing. I can't do it, and it's horrific. But however, never mind about me. You know, so I had a vomiting session one night. I think that was the third night in with staff. I don't know whether that might be nerves. I ain't got a clue. But forget me. I get to my son, right? So okay, he gets an infection. Right? Well, we'll work with that. You know, okay, he doesn't get them very often, but let's see how this goes, blah, blah, blah. To then going into full AD, autonomic dysreflexia. Anyone go look that up in the spinal injury world, and you'll see, especially with my son, he goes that quick. He can well, his eyes went, you know, thank God the RC knew what to do, and he was straight on him with me. And then we had to, I can't remember yes, we did bladder wash. This is how messed up it is. You know, it's just a real mess. Bladder wash. And then we went out, we had to go straight in for a full suprapubic catheter change. Fine, I've got him on antibiotics, blah, de blah, de blah. And I carry on. And then the next thing is he's not feeling good. He's not well. He's got two skin. Oh, my God, what they've done to his ankles, horrific. I've got photographic evidence of everything, and it's just horrific. I don't know what the hell is happening out there in communities with community care, you know, and I hope people are getting the right delivery of care. And the care plans always reflect risk assessments and policies, procedures and backups, contingency plans. Hello, we haven't even got COVID risk assessment. What the heck? Hello, what? Can somebody out there, right, from the respiratory world, be in my field for once, right? Come on out. I know a lot of yous, if anyone gets to see this video, because he's the only person, he was one of the people in Britain that has so many complications, blah, blah, blah. He's got massive respiratory issues, and they've got no COVID care plan. Well, actually, you want to see our COVID file? Where's their COVID file for the year? We haven't got one. We haven't got procedures. People aren't wearing gloves, hence this mask. Hence all the issues. Maybe I got something from touching one of the handles because they're not washing their hands properly, you know. I just don't know. There's nothing in that care plan that reflects to my son. And that includes blowing a suprapubic catheter up that has a balloon inside to attach it. And they've got it down as 5 mils. That's even wrong. What they're trying to do is just horrific. Now, if the government need to change, because people that are getting paid hundreds of thousands of pounds to look after an ICU patient at home, basically, because that's what he is, especially when he's ill. Any other time, he looks normal. I can take him away. We can do things. We've done everything. You know, he looks normal, and he does. When he goes ill, which he's not had, like, he's had 3 COVIDs, but I've not had to do like emergency, like these changes that he's had, suprapubic catheters. There's been another one yesterday, the day before. I can't, do you know, my head's gone. It's shot to shit because this is just horrific. And I hope my solicitor gets to see this, or because, and the CCG who've commissioned it, because you went through 9 care providers. Basically, you didn't even want us getting involved. You didn't even ask for our company policies, procedures. I gave you loads of them. I gave you shitloads to do with Ben. But you never asked for a handover. And that is something that worries me, that whatever you're doing out there, the companies, I can't name them. I'd love to name and shame. I'll name and shame the NHS every day. You know, and I'll name and shame a lot of things, but I can't name and shame them right now, and I will be, because this is my son now could have died in 10 days 3 times. 3 times. So I hope this kind of has got this off my chest now. I made a video, because it always does. I've got things to do. And I'll send this just to maybe my own YouTube, actually, just because I'm so pissed off with like all this NHS shit, COVID crap, and they should have looked into it a little bit more, because we even got involved with the PPE in England, and you know what, half of it was unfit for purpose. And it's just, I'm now seeing a new healthcare system. And if this is brand new system, brand new, which it is, this is a brand new package, a brand new everything. Why is it all messed up? And how many people are you putting at risk out there? Or how many people are actually getting, to a point where they would die? And that's why I'm making the video, because there's probably more that I've missed because my head is shot to shit. And I'm going to go because I've got loads to do. And I thank you for making my own video. Yeah, it's cheered me up.